If you're approaching Medicare enrollment, it's essential to understand the four primary parts of the program: A, B, C, and D. We're here to guide you through each part so you can navigate the process smoothly and avoid any missteps. Medicare can be overwhelming with its various components and letters, and we often hear from individuals who find it challenging to understand. Today, our aim is to simplify and clarify the four main parts of Medicare, ensuring you have a solid grasp of the process as you approach your 65th birthday, retirement, or initial enrollment in Medicare. Let's start with Medicare A and B, which together form Original Medicare. Part A, known as hospital insurance, covers inpatient hospital stays, skilled nursing facilities, hospice, and home health care. For most individuals who have lived and worked in the United States for 10 years or 40 quarters, Part A is premium-free. It's vital to note that Part A does not encompass long-term care facility costs, and without supplemental insurance, individuals will be responsible for co-insurance and a per-claim deductible. The Medicare Part A deductible is the amount that you as a beneficiary is required to pay for your healthcare services during an inpatient hospital stay. In 2025, the annual deductible for Medicare Part A is $1,676 for each benefit period. A benefit period begins when a patient is admitted to a hospital or skilled nursing facility and ends when they have been out of the hospital or facility for 60 consecutive days. It's important to note that with Original Medicare, beneficiaries may have to pay the deductible multiple times in a single year, as each benefit period is considered separately. This can add up if you find yourself admitted in the hospital multiple times. The deductible for Medicare Part A is an essential aspect to consider when planning for healthcare expenses, and understanding how it applies to benefit periods can help beneficiaries make informed decisions about their care and coverage. Moving on to Part B, considered medical or doctor's coverage. This segment covers doctor's office visits, diagnostic testing, ambulance services, preventative care, durable medical equipment, and potentially non-self-administered medications. Contrary to Part A, Part B is not premium-free, often surprising individuals upon reaching age 65. There is also a deductible, and once met, individuals are responsible for a 20% copay without supplemental insurance. One important aspect to consider with Medicare is that there is no cap on the 20% coinsurance that you are required to pay for certain services under Medicare Part B. This means that for services such as doctor visits, outpatient care, and medical supplies covered under Part B, you are responsible for paying 20% of the Medicare-approved amount, with no limit on how much you can end up paying out of pocket. This lack of a cap on the 20% coinsurance can potentially lead to financial hardship for you as a Medicare beneficiary, especially if you require frequent or expensive medical services. Without a maximum limit on out-of-pocket expenses, you may find yourself facing significant medical bills that can quickly add up, potentially causing financial strain or difficulty in managing healthcare costs. It's important for Medicare beneficiaries to be aware of this aspect of their coverage and consider additional insurance options, such as a Medigap policy or a Medicare Advantage plan, to help mitigate the risk of high out-of-pocket costs and protect against potential financial burdens associated with the 20% coinsurance under Medicare Part B. Most individuals become eligible for Medicare on the first day of the month they turn 65, although those under 65 with a disability may also qualify. Now, for Medicare Parts A and B, it's important to let you know that enrolling within the 7-month initial enrollment period is crucial to avoid penalties or gaps in coverage. This enrollment period starts 3 months before the 65th birthday month, includes the birthday month itself, and extends 3 months after. If you're still employed and have credible health insurance, you can postpone enrollment without facing penalties. Medicare Part C, also known as Medicare Advantage. This part offers an alternative to Original Medicare and is provided by private insurance companies that have contracts with Medicare. With Medicare Advantage plans, you can receive your Medicare Parts A and B coverage through plans such as HMOs or PPOs, similar to what you might have had through an employer or the health insurance marketplace. For enrollment in a Medicare Advantage plan, you must be enrolled in Medicare Parts A and B while continuing to pay your Part B premium. These plans cover the same services as Medicare Parts A and B but have their own cost-sharing requirements, copays, and coinsurance. They come with a limit on annual out-of-pocket expenses and provide access to a network of healthcare providers. Medicare Advantage plans can offer additional benefits like dental, vision, hearing, and gym memberships, along with Part D drug coverage, the fourth part of Medicare. Part D focuses on prescription medications and is provided only by private insurance companies approved by the federal government. You can opt for a standalone Part D drug plan with Original Medicare or include it in a Medicare Advantage plan. Medicare Part D allows beneficiaries to access a wide range of prescription medications, including both generic and brand name drugs. The cost and coverage of medications under Part D plans can vary depending on factors such as the specific drugs needed, the pharmacy used, and the plan chosen. However, all Part D plans are required to cover certain categories of medications, such as immunosuppressants, antidepressants, antipsychotics, anticonvulsants, antiretrovirals, and anti-neoplastics. Additionally, some plans may cover vaccines like the shingles shot. It's important for Medicare beneficiaries to enroll in a Part D plan to ensure they have coverage for prescription medications and avoid facing lifelong penalties for delayed enrollment without other creditable coverage. By understanding the benefits and options available under Medicare Part D, individuals can effectively manage their prescription drug needs and costs while maintaining financial security. I cannot stress enough that enrolling in a Part D plan when first eligible is crucial to avoid lifelong penalties. Even if you're not currently taking any medications, it's a good idea to enroll in at least an inexpensive drug plan. Now, as you prepare to enroll in Medicare, you'll likely come across numerous ads and various types of plan information. These different plans can be categorized into two groups: Part C, Medicare Advantage, or Medicare Supplement plans, which complement Original Medicare. Each of these options has its own set of pros and cons, and determining which one is most suitable for you will depend on your individual circumstances. When navigating the complexities of Medicare, one of the best steps you can take is to consult with a licensed independent agent or broker whom you trust. They can educate you on how the various plans operate, helping you avoid enrollment mistakes. At Lehigh Partners Senior Benefits, we provide unbiased advice on Medicare Advantage and Medicare Supplement plans at no cost. Feel free to give us a call. Let's make your Medicare journey an engaging and enriching experience together. Reach out to us today for assistance, and if you found this information helpful, show some love. Like, comment, or share.